Hi, my name is Michelle Fisher, and I'm the manager of the Provincial MAID Program in the province of Saskatchewan, and we'll be speaking to what the MAID application looks like. For those interested in MAID in Saskatchewan, there's one of two ways to contact the Provincial Medical Assistance in Dying Program. The first is by dialing 811 and selecting number 5, and the other is through our toll-free number, which is 1-833-473-6243. Once you speak to us, we will give you basic information on medical assistance in dying, and then we will make all of the arrangements going forth. So we will arrange for the assessors, we will arrange for information to be sent on you, some of our general information on what MAID is, how we deliver MAID, and we will also send the first document that we're going to need filled out, which is the written request. By federal law, all patients who are requesting to have a MAID assessment need to make a written request. We've tried to simplify that process by actually developing a form. So we will send you that form. If you're in the hospital or if you're a patient, in a long-term care facility, or if you are at home, we will get those forms to you. We can either have them faxed, we can deliver them via email, and if none of those options works, we will actually bring them in person. All that written request says is that essentially you are asking to be assessed for your eligibility for MAID. So it's not the assessment, but it's actually what starts the process. By federal law, again, each one of those written requests has to have a witness that signs it, and that witness cannot be anybody who would benefit from your death. So it generally takes out any family members as a husband or a wife, children, but healthcare providers can sign that form, close friends can sign that form, people who don't even know you can sign that form. You would just have to show them proof of identity. We don't need anybody as specialized as a notary public. We don't need anyone like that. Just somebody who's able to confirm that it was you who signed the form. And that requirement is in place, of course, to protect everybody legally, that nobody would be making a request on your behalf, because only you can choose for MAID to start, and only you can decide if MAID will be given. Once that form is completed, it's returned to us. And again, that can be done by picture taken of it, and we would give you phone numbers and all of that once you started this process. They can be faxed, they can be emailed. Once that written request is returned to us, depending on your condition and how quickly you would like the assessments to start, we will then organize 2 assessors. They can be either a nurse practitioner in Saskatchewan or a physician, or a combination of those 2. We will then arrange for 2 of those individuals to see you. And again, we can see you either virtually or we can see you in person. Since the advent of COVID, we've been doing a lot more virtual assessments. Those assessments probably take anywhere from half an hour, 45 minutes. And it's really just for those practitioners to get a better understanding of your disease process, really why you're asking for MAID. And then after that form is completed, it's returned to us. And again, that won't be your responsibility. That'll be our assessor's responsibility who return that form to us. And then pretty much the paperwork is all done. So we've completed a written request, 2 assessments, and then the paperwork is complete. That does not mean that you have to have MAID that day. If you have what we call a foreseeable death, there's technically no wait time from the time those forms are completed till you could go to what we call provision, or to receive medical assistance in dying. However, it is dependent on what our providers are able to accommodate. They do the work of assessing and providing MAID on top of their full-time duty, so it just takes a bit of coordination sometimes. So MAID can be given in the home, it can be given in hospital, it can be given outside, it can be given really anywhere that's appropriate for it to be given where a patient is safe, and of course our team is safe. We've been in barns with horses around us, we've been on the top of hills, and of course we've been in hospital rooms, and we've been in patients' homes. All of that is discussed with the family and discussed, more importantly with the patient about what they would like. If the patient is applying through a non-foreseeable death stream, then there is a 90-day wait from the day that one of the assessors makes you eligible until you could have medical assistance in dying. And that's the minimum. Sometimes we need to do a lot more information gathering. We have specialists you may need to see. The process is a little more complicated or laborious if someone is applying and their death is not foreseeable. That doesn't mean that they're not eligible. It just means that the feds have requested that we wait a certain amount of time to ensure that all of those boxes have been ticked for the non-foreseeable death patients. Once a patient decides that they're going to have MAID, then what happens is we always come to you. So we will come anywhere you would like us to come, as we had discussed a little bit earlier. And generally, we always travel in a pair of two. So we will have a nurse generally with us, and then either the provider assessor who saw you. So if it might be myself and one of the NPs, it could be one of our other nurses and a doctor. It's whatever we need that day to ensure that we can safely provide care to the individual. We also have a social worker. And so if we need her, if a family is really struggling or a patient is really struggling, we actually will sometimes bring her also. At the end of the day, the timeline is really driven by what the patient's needs are. So if patients don't need urgent care, then we've got a little bit of time. And again, it's very dependent on what the individual needs. One comment I do want to make based on that, though, is that MAID is never considered a medical emergency. There are still federal guidelines that we must follow, and that just takes us some time to get that organized and done. Generally, patients in Saskatchewan are seen anywhere between 24 hours and 3 or 4 days. And our offices run Monday to Friday from 8 to 4:30, and we're closed on weekends and statutory holidays. I think the most unique thing to know about Saskatchewan is once the patient calls us, we look after everything. The patient does not have to find providers. They don't have to find assessors. The only thing that they require is the paperwork with regards to their written request, and the Provincial MAID team will help them with that also. A referral is not required from your family doctor or from a specialist. Anybody can refer to me. So a patient can refer, family can refer, social worker can refer, a nurse can refer. It's really independent of anyone else having to get you to our program. If there's any questions, all you ever have to do is call 811 and select number 5, or the toll-free number at 833-473-6243. Thank you and have a great day.